and welcome back to Sauti Mzalendo TV News. I am your fellow Kenyan here at Sauti Mzalendo TV. Today, I'm going to talk about our Afya House, where the health ministry is total in civil war. Why is it in civil war? Kenyans, have you ever wondered why our healthcare systems always seems to be in crisis? Why hospitals lack doctors, nurses, and go on strike all the time? Patients are left helpless. Well, the answer may not be just underfunding. It could be the chaos that is happening inside the Afya House itself. Sit tight and comment. A damning new report by a presidential task force has revealed shocking levels of a dysfunction inside the Ministry of Health. It is not just mismanagement. It is a total civil war. Led by Professor Hamarogo, the task force exposed deep divisions between the two principal secretaries, medical services and public health, who barely speak to each other. Imagine running a whole ministry without communication. Really? No wonder policies are clashing. The decisions are made in confusion. The report paints a picture of broken system where no one knows who is in charge of what. With 43 different types of healthcare workers governed by conflicting laws, it is a recipe for disaster. The task force described it as a chaotic mess of policies, regulations, and outdated laws that makes it impossible to run healthcare efficiently. This is true. How can you run a government or an office without communicating to each other? But that is not all. The report reveals a massive data crisis. Believe it or not, my fellow Kenyan, the Ministry of Health does not even control its own data. Instead, critical medical information is in the hands of donors. How can Kenyans manage its health system when outsiders control its information? Ask it and answer your question by yourself. The conflict does not stop within Afya House. The task force discovered a discontent between the national and county governments, leading to confusion over hiring and deploying medical personnel. Even worse, the Ministry of Health and the Ministry of Education don't talk to each other, meaning that students graduate as doctors and nurses without a clear plan for employment. This is so serious, and that is why, Sauti Mzalendo, you are here. You need to join in and talk about this, because this concerns us. With such chaos at the top, is it a surprise that ordinary Kenya is suffering? The National Assembly's Committee on Health, chaired by Member of Parliament Robert Koso, has vowed to fix this mess by enacting new laws. But will politicians deliver? Or is this just another promise that will be forgotten? Let us see how it goes. Kenyans, here is the big question. If our health system is in shambles, who is really to blame? The ministry's leadership, the politicians, or is it people to demand the really accountability? Sauti Mzalendo will be watching closely because your health is not a joke. Remember, your voice matters. Comment, share, and like to keep the conversation going. Thank you for watching.